Hello everyone. Today, we're delving into the world of a medication known as digoxin, commonly recognized by its brand name, Lanoxin, and its generic name, Digoxin. As always, our discussion is for educational purposes only. If you have health-related questions or concerns, it's essential to seek guidance from a medical professional. Description: Digoxin, sold under the brand name Lanoxin, is a medication available in oral and injectable forms. It belongs to a class of drugs called cardiac glycosides, primarily used to treat heart conditions such as congestive heart failure and certain types of irregular heartbeats, arrhythmias, particularly atrial fibrillation and atrial flutter. Approved by the FDA, digoxin has been in medical use for many decades. It works by increasing the force of contraction of the heart muscle, thereby improving its pumping efficiency and helping to regulate heart rhythm. This medication is often prescribed in combination with other heart medications, as directed by a healthcare provider. Warnings: before initiating digoxin therapy, it's important to be aware of certain precautions. This medication should not be used in individuals with certain heart conditions like ventricular fibrillation or ventricular tachycardia unless it's as a temporary measure to control rapid heart rate. Additionally, those allergic to digoxin or any ingredients in the formulation should avoid its use. Patients with certain electrolyte imbalances such as low levels of potassium or magnesium should be closely monitored during digoxin therapy, as these imbalances can increase the risk of digoxin toxicity. Digoxin should be used cautiously in patients with thyroid disorders, as it can affect thyroid function tests. It's crucial to inform your healthcare provider about all existing medical conditions and medications, including over-the-counter drugs and herbal supplements, before starting digoxin therapy. Before taking this medicine. Before starting digoxin, it's important to discuss your medical history and current medications with your healthcare provider. This includes any allergies, heart conditions, electrolyte imbalances, kidney or liver problems, thyroid disorders, and other relevant health concerns. If you are pregnant, planning to become pregnant, or breastfeeding, it's essential to inform your doctor, as the use of digoxin during pregnancy and lactation should be carefully considered. Regular monitoring of blood levels and heart function may be necessary during treatment with digoxin to ensure its safety and efficacy. Side effects: like all medications, digoxin can cause side effects, although not everyone may experience them. Common side effects include nausea, vomiting, loss of appetite, headache, dizziness, confusion, and changes in vision such as seeing halos around lights or experiencing blurred vision. More serious side effects, although rare, may include severe allergic reactions, worsening heart failure symptoms, irregular heartbeats, and digoxin toxicity, which can manifest as symptoms like excessive tiredness, weakness, dizziness, fainting, irregular heartbeat, and visual disturbances. If you experience any concerning symptoms while taking digoxin, it's important to seek medical attention promptly. Interactions: digoxin has the potential to interact with other medications, supplements, and herbal products, which can affect its effectiveness or increase the risk of side effects. It's crucial to inform your healthcare provider about all medications you're currently taking, including prescription drugs, over-the-counter medications, vitamins, and supplements, to avoid potentially harmful interactions. Dosage: the dosage of digoxin varies depending on the individual's medical condition, kidney function, age, and other factors. It's important to follow your healthcare provider's instructions and take digoxin exactly as prescribed. Dosage adjustments may be necessary based on regular monitoring of blood levels and heart function. Never alter your dosage without consulting your doctor. Avoid: while taking digoxin, it's important to avoid sudden changes in dietary intake, particularly high-fiber or high-calcium foods, as they can interfere with the absorption of the medication. Alcohol should be consumed in moderation, as excessive alcohol intake can worsen certain side effects of digoxin. Additionally, it's advisable to avoid activities that require mental alertness or coordination until you know how digoxin affects you, as it can cause dizziness or drowsiness in some individuals. FAQ: many individuals wonder about the potential for digoxin toxicity. While rare, digoxin toxicity can occur, especially if the medication levels in the blood become too high. Symptoms of digoxin toxicity include nausea, vomiting, confusion, irregular heartbeat, and visual disturbances. It's important to seek medical attention if you experience any of these symptoms while taking digoxin. Closing: that concludes our overview of digoxin. Remember, this information is intended for educational purposes only and should not replace medical advice from a qualified healthcare professional. If you have any questions or concerns about digoxin or your heart health, be sure to consult with your doctor or pharmacist. Thank you for joining us today.